Welcome to Monday's edition of COVID-19. It's been about 2 months since the start of Korea's inoculation campaign, and the goal by the end of this work week is to have offered the first dose of the COVID-19 vaccine to 3 million people. We have details later on. Here first is the broader pandemic coverage with our Kwon So-ah. So let's start on the local front. As usual, fewer testings this past Sunday have led to a decline in new infections.
Right, Sunny. We're seeing around 140 less cases than on Sunday, with exactly 500 infections reported as of 12 a.m. That is 469 domestic transmissions and 31 imported cases. Now, for the first time in 6 days, the number has dropped to 500, but we've been seeing surges to the 700s by the middle of the week, so we will still have to monitor the situation throughout the week. And the average number of domestic infections in the past week stands at 647, and with that, the total number of cases now is at 119,387. If we turn to our map now, we have around 150 cases in both Gyeonggi-do province and the capital Seoul, also more than 20 cases in many parts of the southeastern part of the country. Now, along with the current social distancing measures staying in effect until the end of this Sunday that is, health authorities have designated this week as a special containment period, during which after-work group dinners among civil servants will be banned, and also working from home in the public sector will be expanded.
Right. Meanwhile, on the local vaccination front, so I hear we can expect a faster pace.
Yes, Sunny. Following the government's announcement over the weekend that it has a new contract with Pfizer with some additional 20 million vaccines for some 20 million people, that is, Acting Prime Minister Hong Nam-ki said in a public message this Monday that this will enable preparations for vaccinations for minors and also for booster shots in response to variants. And he also said this.
With the 40 million additional Pfizer doses we've recently procured, the government will make its best effort to reach herd immunity before November, even if it's just by a day.
And for a closer look at the government's vaccination plan, 3 million vaccinations are to be completed by the end of this month, 12 million by the end of June, and 36 million by the end of September. That would be around 70% of the nation's population. And as of 12 a.m. this Monday, we have a total of 2.26 million vaccinations completed. Now, meanwhile, the number of globally administered COVID-19 jabs has hit the 1 billion mark, according to an AFP tally over the weekend. And that's at least 207 countries since the vaccinations programs began less than 5 months ago. And the most widely used vaccine was AstraZeneca, followed by Pfizer. Nevertheless, the number of infections is still rising, with almost 730,000 cases reported in the past day. And although the US, China, and also India make up more than half of the vaccinations completed so far, India is still struggling with over 350,000 infections in just a day. The country has been seeing for 5 days more than 300,000 cases. Sunny will connect to India in a bit. Also, France, Italy, Spain, Germany are some European countries where vaccination is going slower than predicted. And low-income countries account for just 0.2% of vaccinations so far. And those are the updates I have for now, but I'll see you back in a bit after the government briefing. Sunny?
All right, so thank you for that. Right, now, as Soa mentioned, India's COVID-19 situation is raising much alarm across the globe as it sets fresh global highs in daily infections, with well over 300,000 new cases per day. For more on the situation there, I have Tarun Kalyanam live on the line. Welcome, Tarun.
Yeah, hi, Priya. It's Tarun from India.
Right, Tarun, let's begin with the healthcare situation in India, which I hear is nearing collapse.
Yeah, exactly. The lot of situations have been collapsed in India. Why? Because we have been very lack of beds and hospitals and etc. The basically thing is now we are present with 192k deaths and we are in the highest. Past of first wave was very good, but this was the experts have been saying that this was the second wave was very deadly thing. So we have been lack of beds. We are total population of 136 crores, but the ventilators have been supplied by the government is 1 lakh. It was the major drawbacks which we can't even affordable of these all things. And the COVID situation was the hospitals, the patients have been traveling from one hospital to another hospital. That was the biggest handling. It was very hard for us.
Tarun, is it true that 2 or 3 patients are sharing the same bed at government hospitals?
Yeah, exactly. The 2 to 3 patients have been sharing the same beds and the same oxygen cylinders also. Why? Because we have the lack of oxygen present right now, and they have been exporting from other countries and a lot of the lower states.
I see. Tarun, I believe the surge in COVID-19 fatalities is also overwhelming the country's cremation facilities. Could you tell us a bit about this reality?
Yeah, the crematoriums and burial grounds have been totally filled with the freshly dead bodies of the COVID. One of the biggest situations have been taking out right now. The cremations have been running with non-stop in around the clock. The pulling out with the smoke from the flesh, which was from the COVID bodies, which was giving the health risk to the Indian citizens also. Considering these all situations, a few of the states were giving the electrical crematoriums so that it could be faster and move on better.
Tarun, what do you suppose is to blame for this latest frightening outbreak in India then?
Yeah, one of the breaking out is the Indian government giving the permissions for the lot of crowd pooling areas. Like recently, there was a festival has been gone through at the banks of Ganga River, which is Maha Kumbh Mela. There were the people of 3 to 4 crore people have been gathered there for the holy baths. And there are a lot of students who are from the Andhra Pradesh and few Tamil Nadu states also. People have been going to the schools and they've been spreading the viruses. Why? Because the beginning of the schools, it was giving the major back for the family members. And not only these, the elections also have been rapidly going on. And these are the biggest situations now we are in the severe part of the country where we couldn't afford for the oxygen cylinders also.
Meanwhile, Tarun, how is the vaccination campaign in India proceeding?
Yeah, the vaccination campaigns have been going very good in India. Present now, the first dose has been done with 100 million people, and the second one was completed with 17 million. And the central government, the Indian government, has been planning for giving up for 250 million people by up to the June. And present the plus 45 age or the older citizens have been given the dosages. And from the May 1st week, they have been giving for the 18 plus above to all the adults also, they have been giving it out. This vaccinations, hope it goes good.
Tarun, what can you tell us about the triple mutant variant that was recently identified in India?
Yeah, the new mutant strains we already known about. The last month we are the 14 times faster than before, and now we are into the 18 times faster. There was a 2 mutant virus, which is double mutant and triple mutant virus, also been detected here, which was B1617, which is the double mutant virus, where the 40 plus people have been registered with this virus in few states like Maharashtra, West Bengal, and New Delhi. And the triple mutant virus is the B1618, which is known as immunic escape of mechanism, which was traveling through the air in the 20 meters. This was people have been affected up to 20 plus people have been affected in a few states like West Bengal and Maharashtra, which are the very similar conditions we are giving it out. And basically this characteristic of this was asymptomatic symptoms were been seen in the people who are adults and mostly found in the adults who have been found for the triple mutant virus.
Tarun, the last time you were on the show, you talked about how people not abiding by social distancing measures in the country. Has this changed in India?
Yeah, actually, this has been not changed. This was the biggest major throwback and hitting the country's result of affecting the deaths and the corona cases. The major thing was the people who are going for vaccinations also, they are not maintaining the social distance or putting the proper mask. Actually, the COVID experts who are from the scientists have been from the India saying that to please put on the N95s or N99s, but the government should give them the little bit of information or education about the masks or sanitizations.
All right, Tarun, as always, thank you very much for your time and for your thoughts.
Yeah, thank you so much, Arirang.
Right, it's time now for the regular COVID-19 briefing here in Korea for this Monday.
And as of today, we will begin our regular briefing for today, April 26th, Monday. First of all, here are some updates on COVID-19 vaccination status. Starting from today, we will be rolling out the vaccinations to the healthcare providers as well as people with chronic kidney diseases, and we aim to provide the inoculations for about 269,000 people, and also the essential social workers as well. And the target group of the recipients will be able to look up their information and also can make their reservations in advance by calling up the designated hospitals or through online. And they can be administering their shots at about 2,000 designated hospitals nationwide. And the US FDA also has said that in March also, they said that as for the Janssen vaccines, and they have been carried out 2 times of the analysis with the correlation of the blood clots, and they have also announced that they will be resuming the Janssen shots. And US CDC and FDA has said that in order to prevent the COVID-19, they have expressed trust and confidence in Janssen's effectiveness. And they say also that the benefits of getting the shots far outweighs the risks of side effects. And the CDC and FDA also has said that after the Janssen inoculations, as for the rare blood clots, the risks are very low. However, they will be carrying out close monitoring and inspection going forward, and also advised all of the recipients and the doctors to be well aware of such side effects, which are indeed rare. And also after inoculation, we have some adverse responses that have been reported here in the country, and here are our weekly analysis for this updates. And this week we have seen 1,338 cases of the post-inoculation adverse responses, and among them, 1,229, or about 95.6% of them were mild and common symptoms common for after inoculation. And also during the past week, we have seen that the total, out of the total caseload, we have seen that about 0.1% of the adverse responses have been reported, which is on a steady decline. And as for the 9th compensation team, we will be updating the results a little bit later by a respective employee. We have Mr. Kim Jun-gon, who is the head of the compensation team, and he will be updating us on the details. I am Kim Jun-gon, in charge of the compensation team. And on the 24th of April, we have had our 9th round of a meeting, and here are some updates. First of all, as for the casualties, we have been looking at 11 casualties, and here are some details. Right now, up until now, we have been accumulating related data, and we have been looking at the patient's underlying diseases, and we have seen pneumonia as well as other acute diseases that have been contributing to their death, and we have seen a very low correlation between their death and the inoculation. And as for the adverse responses, we see that it is very difficult for us to acknowledge the correlation with the vaccines, and therefore this is the conclusion that we have reached so far. And out of the 11 cases, 3 are under further investigation and are undergoing autopsy. And after the results, we will be also having another round of a review. And we also looked at 11 severe cases as well. And as for the 10 severe cases, we have seen it is very difficult for us to confirm that there has been a correlation with the vaccine. However, as for one case, we have seen some suspected cases of infections, and we also carried out that we will be holding our conclusion, and we will be further accumulating more data, and we will having another round of review. So this sums up our the 9th meeting review.
네, 그러면 기자님들 질의 답변 시간 갖도록 하겠습니다. 주입 기자단으로부터 받은 먼저 사전 질문. 네.
We will be explaining further on the quarantine measures. Weekly, as for the 18th to 24th of April, we have seen 659 average cases, and this is about 6.1% increase on week, and it has been on a steady increase for the past 5 weeks. However, we are seeing a relatively lower rate of the fatalities as well as those in the severe conditions. And right now, we also have a nationwide infections coming emerging. And aside from Honan province, we are seeing all of the other regions reporting cases, and we are seeing a steady incline in these regions as well. Especially for Gyeongbu, Gyeongnam, and the capital area, we are seeing a steady increase of our daily infections. And we believe that this is attributable to the increase in the number of and the amount of physical contact among people. And we also see that many people who have been hidden sources of infection, and we also see widespread of infections at day-to-day venues. And in particular, we are seeing infections among family members, peers, and colleagues, as well as the infection stemming from outings, which also can be contributed to the seasonal factor. And also at multi-use facilities, this infection is also spreading through local transmissions and connecting to the infections to families and workplaces and so forth. So to this end, the quarantine authorities are carrying out our ministerial level responsible duty scheme, where they are looking into the quarantine measures by facilities as for the multi-use facilities. And also in May, we will be devising our detailed guidelines for the month of family. And we will also intensify our monitoring for the new variants as well. And we believe that it is very important to identify the patients at an early pace, and we also will like to contain the further spread of the virus going forward. And right now, we are seeing hundreds of daily cases here reported in the country. And during the past week, also, we have seen a 5-week increase of the average daily domestic infections. In order to stem the infections and in order to prevent another large spread outbreak, it is a very important for our members of the public to comply with the quarantine measures. And if you are going to indoor or outdoor places that are crowded and that are frequented by people, please wear your face mask. And also, please refrain from going to any non-essential outings, and also comply with the gathering ban of more than 5 people. If you have any suspected symptoms of COVID-19, please do not go to work or school. Rather, visit a screening clinic nearby to get tested as soon as possible. You shall never visit a multi-use facility if you have any symptoms. We also would like to ask you to have credibility and trust in the government's plan and information on the vaccine procurement and inoculation. So we ask you to participate in our inoculation plan as well. And also right now, the government has secured the vaccines that have been proven with its safety and effectiveness. And we also believe that the benefits of inoculation far outweighs the risks of side effects. So we ask you to take part in our inoculation rollout. The quarantine authorities will also like to exert our full efforts to carry out quarantine measures in order to contain the further spread of the virus, and we will also make sure that everything goes as planned. Thank you very much.
Right, there was Lee Sang-won with Monday's afternoon briefing. So what did he have to say?
Well, let's start on the vaccination front as he started with the new vaccination plan that starts today for groups such as police officers, firefighters, pharmacists, doctors, and dialysis patients. And also another expert had some analysis on recent adverse reactions as well as post-inoculation deaths. There were 11 people post-inoculation fatalities that were analyzed, but there was found to be no correlation between the death and the vaccination. He said there was a low chance, a very low chance for that to be correlated. And also there were 11 severe adverse reactions that have been analyzed, out of which 10 were found to, it was difficult to say that there was correlation between the vaccination and the severe reactions, and one case needs further review. And when it comes to infections, in the past week, we saw a rise by around 6% on a week, and in most parts of the country, except for the Honam region.
I see. All right, so as always, thank you for that.
My pleasure.
Also on the local front, in response to growing demand for non-face-to-face interactions amid the pandemic, Seoul city officials have opened a virtual platform for active communication. Our Chun Song-cho is out on location. Hello, Song-cho.
Good afternoon, Sunny.
So, Song-cho, where is this virtual meeting studio?
Well, I'm at the DDP, or Dongdaemun Design Plaza, a landmark in Seoul that's usually known for being the venue of the Seoul Fashion Week. But today, I'm going to show you a different side of the facility, a new feature that's been added very recently, just about a week ago. So first, I'm going to show you the main studio in a bit, but I'm going to show you other different rooms that's available here. For instance, this conference room, it's for a teleconferencing session where dozens of people can actively communicate with people on other parts of the world using that ginormous screen there. And there are also like powder rooms, waiting lounges, and there are also interpreter booths. That means meetings can take place using the simultaneous interpreters. So this platform, the Seoul city government said that it's going to use this platform to hold various events and virtual meetings from now on so that they can carry on with their works and projects from now on in a safe and efficient manner, even amid the COVID-19 pandemic. So this is the main studio, voila. The most outstanding feature of the studio is probably this ginormous screen. It's reportedly about 35 meters long, and it's incredible because it's curved, it's long. It almost gives you a really wide range of view of the studio, like almost like 360 degrees. And also you may wonder where the cameras are. And actually, they're attached to the ceiling, so it allows the participants or even viewers to have the to move around and have the immersive experience. And the studio is also equipped with some of the best sound and stage lighting instruments available out there, using the latest broadcasting technology and this LED screen. The studio can transmit high-resolution images to and from wherever parts of the world. And the good news is that any individuals or private businesses can use this facility. And if you want to organize a virtual big, large-scale event, then you can go on the website, the official website of DDP, and make a reservation there. So right now, why don't we invite one of the officials who are in charge of running this place. Good afternoon.
Good afternoon.
All right, so first of all, I want to ask you how this idea came to fruition. I mean, why did your team think it was necessary to have such facility open to public at DDP?
DDP is a famous convention place in Seoul. Big events such as fashion shows, global conferences, and product launching shows have been held here. Since last year, however, these events have been canceled due to COVID-19. Instead, our clients have moved to online platforms like YouTube and Zoom. Following the current online trend, DDP has created Seoul On, a big video conference facility that fits our clients' needs.
All right, and I think it's especially efficient because of the location. It's at the heart of the city, so it makes it incredibly convenient for people to have meetings here. Then can you share some of the works, projects that are in the plan for the future?
Seoul On opened just 1 week ago, but we are already almost booked until the end of this year. Most of these reservations have been for global conferences or ceremony events. World-famous K-pop boy band BTS held a press conference at DDP in 2019, and we hope that a future online press conference or fan meeting would be held through Seoul On soon.
All right, maybe we can invite BTS back to the studio once again. Thank you so much for your time. Thank you.
Thank you.
All right, so this past year has been a revolutionary year for every sector, every business, but particularly for the corporate event management. And this Seoul On Studio is one of the latest additions to the facilities that make events very interactive, innovative, and dynamic. I can't wait to see how event technology will further transform critical aspects of events, making them more engaging, enjoyable, and organized to audiences. This has been Chun Sung-cho reporting live from DDP, and back to Sunny in the studio.
All right, Sung-cho, as always, thank you for that coverage.
이번 파이자 추가 구매를 통하여 집단면역 달성시를 보다 앞당길 수 있는 기반을 마련하였고 18세 미만에 대한 접종 확대, 변이 바이러스 대응을 위한 3차 접종 등 추가 소요에도 선제적으로 대비할 수 있게 되었습니다.
스푸트니크 백신에 대해서는 현 단계는 자료 수집 그리고 고객의 여러 가지 상황에 대한 모니터링을 하고 있는
자가 검사 키트는 기관 관찰 검사에 비교할 정도로 정확도에 차이가 있는 만큼 국민들께서는 자가 검사 키트 검사를 보조적인 검사 수단으로 활용해 주실 필요가 있겠습니다.
As part of its latest efforts to expand its vaccine arsenal, Korea has signed a deal with Pfizer for additional doses for 20 million people. Now, for more on this deal and on related efforts, I have Professor Kim Moon-kyu from Yonsei University. Welcome back, Professor Kim.
Good afternoon.
And I also have Dr. David KWAK from Soonchuneng University Hospital. Good to see you again, Dr. KWAK.
Good afternoon.
Now, Dr. KWAK, taking into account the additional Pfizer vaccines for 20 million people, Korea, by contract, has secured enough doses for 99 million people. What are your thoughts on our procurement efforts?
Well, it's obviously great news. Having enough doses to cover not just once but twice of the whole population is definitely a great news, and I can attest to that. That we have plenty of dosages secured for our own country at this moment. One thing that is still in the air, the question that is in the air though, is that how secure will it be on our soil? Well, those are some of the political matters, I guess, that people are asking if it's actually going to be on our soil by the time that the government has claimed that it would be on. But I'm having my fingers crossed that it would be, and the government apparently has claimed that we will be able to cover up to about 70% of the whole population inoculated by the time of July. So I'm also hoping for that. I guess also the government has stated that we are going to speed up by expanding the inoculation sites, and I can personally attest to that. That is actually happening right now because my personal hospital, the place that I work at, has started inoculating the regular general citizens as well. So I think that is going to take place. I hope that the pace will take up and speed up so that we will cover enough people by the short time in the future that enough people will be inoculated by July, that we will hopefully reach herd immunity by November.
Right, I think it was like 36 million people with the first dose by September then. Mm-hmm. I see. Professor Kim, Pfizer is seeking a new version of its COVID-19 vaccine, one that can be stored in a standard freezer. And Pfizer is the only vaccine that's available to those aged 16 and 17, something that Korean authorities are also looking into. Do you believe these factors will serve to boost our inoculation drive?
Oh, definitely yes. The cold chain is something difficult to maintain, but anyway, if we solve some problems that might happen during the process, that is a good news. And the other thing is that I'm very happy that we have an option for those high school students. In Sweden, they didn't, they had a loose quarantine measures all through the pandemic.
So they didn't close the elementary school, they didn't close the junior high school. But even though they closed the high schools because students, high school students are getting infected. So I think high school students need something, and the university entrance exam is one of the most important events for the students. So to get all the examinee vaccinated before November is going to be a big challenge, and I think we don't have enough time to finish all of them, so we have to hurry up if we want to do that. And the next challenge is the elderly group, the age older than 75. We had only 20% vaccinated right now, so which one is more important? I don't know how to decide, but there is a priority issue also. So it's going to be a hard decision. But anyway, it's a good news that we have something for the high school students.
Right, definitely. Dr. KWAK, authorities here are also gathering information on Russia's vaccine. Now, what do we know about this vaccine thus far?
I think Sputnik V, which we are mentioning here, is really in the anticipation stage right now. I don't think the government has formally claimed that it will start to import it yet, because I don't think it cleared the examinations that it has to go through the government. Not only ours, but the European Medicines Agency has also started the rolling review of it, meaning it hasn't cleared it yet. So Sputnik V, as far as I know, it has in its clinical trials and in its uses in Russia, it has created some just regular side effects such as skin irritations or flu-like symptoms such as fever, mild headache, muscle pain and whatnot, but those were all seen from other vaccines as well. One thing in particular that we probably would be more interested in is whether it can cause the blood clotting issues as the other two adenovirus viral vector vaccines have caused. The manufacturer of this vaccine claims that there hasn't been any cases of thrombosis. But European agencies are claiming that there were cases of 4 death cases soon after the vaccination, which might or might not be related to the vaccines itself. So I guess there would need to be further reviews and further studies about possible side effects. But at this point, the manufacturer itself claims that there hasn't been any such side effects, and because of a particular reason they actually explain that they use quadruple of cleaning method that they use. I don't know if that is actually the reason behind it or not, but we would definitely have to look deeper into this.
Right. Professor Kim, what are the chances of the rollout of Russia's vaccine here in the country then?
First of all, the first impression of Sputnik V was not trustworthy because there was no academic reports for a while, and there was a premature approval by the Russian government. So that's something unusual. Now we have a report from Lancet, and the data shows that it's quite effective, but I think we need a real-world data backup, just like Pfizer vaccine from Israel. So we have to wait for that, and the importation to South Korea will be decided by authorities, but there are some kind of confusion because so many comments made by some people, who want to gain attention. So I want to emphasize that we have to put this decision on the persons who are responsible, the experts. And in Korea, it's produced by Chorus Pharmaceutical Company, and I think they sent to Russia for validation. I think it's going to follow the market principle approach, but the main decision whether we're going to use it or not should be decided by vaccine effectiveness and safety, and also the demands of our country.
Right. Meanwhile, Professor Kim, authorities in the US have resumed the rollout of Janssen's vaccine following a brief halt amid reports of blood clots. Now, what can you tell us about its safety? CDC USA reported that there was about 15 cases of TTS, which means thrombocytopenia syndrome, out of 8 million.
they were all females, unfortunately, and 12 of them happened in the brain, and the 3 died of that. And it's about twice much frequent than natural cause. So the Advisory Committee on Immunization Practices concluded that it's going to be approved for people more than 18 of age, but females younger than 50 should be warned for that kind of complication, TTS, thrombocytopenia syndrome. Still, they think that benefits is more than harm, and if a female younger than 50 wants an alternative, I think they're going to guide to another vaccines such as RNA vaccines.
Right. Dr. KWAK, self-testing kits will soon be available for members of the public for purchase at pharmacies and as well as online. In a span of 15 minutes, a person will know whether he or she has been infected with COVID-19. What are your thoughts on the accuracy of these kits?
Well, I'm quite worried. I just don't want people to get the wrong connotation that it's the decision maker. Because these self-testing kits, they have, I believe Dr. Kim's going to also mention something in regards to this, but it has a very low sensitivity, which means that it has great potential to cause false negativity. Meaning a person, let's say, who wants to test before going into certain occasion, let's say call it a concert he or she is trying to go to, the person wants to make sure that him or herself is negative before going in. That test, if he or she was only tested through the self-test kit, could test falsely negative, and when the person is actually positive, it could create dire consequences. So in regards to this should only be done in an addendum to a massive screening RT-PCR throughout the population. This cannot be done in making a decision whether or not the person would be safe to, let's say, attend something, a class or something. It can be done in a more general situation, though, in regards, so if a person, let's call it a society, if a society is to be screened, not for the negativity, but for the purpose of picking out even further people who might be positive but being asymptomatic, this test maybe can use in that situation. But this should never be tested be in use in a situation for the safety issue.
Right. And Professor Kim, keeping in mind the concerns raised by Dr. KWAK, what in your thoughts are ways of making the most productive use then of these self-testing kits?
Very difficult. They say they have a high specificity, which means if it's positive, it's going to be COVID-19. But sensitivity is an issue, which is about 80 to 90% according to the 2 companies they are producing. And no problem when it is positive. So you go to the physician or hospital. The real problem is when it is negative. COVID-19 starts spreading 1 to 3 days before symptom onset. So I don't know, maybe useful when PCR test is impossible, but still it's going to have a limited significance.
Right. Meanwhile, Dr. KWAK, some are claiming that Korea's daily tally may hit 1,000 in the near future as the current outbreak remains largely untamed. Do you share this grim outlook?
I really don't want to, but I think it's possible. As we have seen throughout the last few weeks or so, it has been steadily and gradually increasing. And what it tells me is that, we've started seeing these numbers quite a lot in the metropolitan area, but also in the Gyeongnam and Gyeongbuk area and the Jeonnam area. So these tell me that, the numbers tell me that it's an expansion of domestic cases spreading. And from the prior huge waves that we had before, the baseline of these numbers, how high it is, sort of decides how high of a wave we will get afterwards. So if we sort of pile up the baseline this high, if we unfortunately reach, let's say, 1,000 of a day, then start to get a huge wave after that. That wave, the fourth wave we will possibly see, will be much larger than any couple of the ones that we have had before. So that's the danger in this. Only a positive side that I can think of right now is though that the mortality rate and severity rate, as the government claims, is very low. For the past week, I've been monitoring the death cases and the daily case numbers coming out of Seoul, and I've actually noticed 5 straight days without any death at all. So that's something clearly we're really working well on right now, and we should keep it that way. I hope that numbers spread also to the other regions so that the death numbers and the severity rate will stay low. But in regards to the number, we still have to keep the numbers low. So I guess that's something the government has to take into consideration when they're deciding the social distancing level.
Right, and staying with the grim note, Professor Kim, a nursing home in Bucheon City reported 50 related cases of infection post-inoculation. What are the implications of this finding?
We have to know that what kind of vaccine they had and how many days after the first shot they got exposed. Nursing home, nursing hospitals, yeah, usually they have a high-risk group. And if you look at the Israel data, they said that 60% showed antibody positive after the first dose. It took about 2 weeks to have a positive for 60%. And about 2 weeks after the second shot, then the effectiveness reached more than 90%. So that means you are not safe until the second dosage. If the persons had a AstraZeneca, it would be a little bit different. Maybe they say that after 3 weeks of the first shot, they show that it is effective. So we have to understand that after the vaccination, still we have to be careful. And even though you keep all the instructions, still there are some breakthrough infections. And from the United States, they say that there are more than 7,000 cases of breakthrough infections. But still, it's not a big deal. They continue vaccination program. And well, vaccine is not supposed to be 100% perfect. So we must continue our quarantine measures after vaccination, especially before vaccine becomes effective.
Right. Staying with vaccination, Dr. KWAK, one of the most common side effects after vaccination is a headache or fever. And doctors claim that for painkillers, taking a Tylenol will be least likely to affect or interrupt your immune response. Could you tell us this, explain this for us?
Sure. That's in regards to the immune reaction. What we call the NSAIDs, the ibuprofens or Advils and those sort of deals, they tend to reduce immune reaction to any sorts of agitation, even the vaccination. Tylenol, on the other hand, has, as of yet, no such proof. So that's why they're claiming Tylenol is safer to use rather than the immune-reducing agent. So that's why that was brought up.
I see. All right, Dr. KWAK, as always, thank you very much for your thoughts. And Professor Kim, thank you very much for being with us today.
Thank you so much.
Right, and that brings us to the end of this edition of COVID-19. Do seek to do your part in stemming the spread of the virus. Thank you for watching.
The COVID-19 outbreak is showing no signs of subsiding here in South Korea. In fact, we're at a point where we have to worry about an onset of the fourth wave. In order to prevent that, the government came up with new, more detailed prevention measures under the current social distancing guidelines.
As the weather gets warmer, people are spending more time outdoors and dropping their guard against a prolonged COVID-19 outbreak. The number of cases spiking all across the country.
4차 유행에 진입하는 초기 양상을 보이고 있습니다.
In order to prevent the fourth wave and maximize the effect of disease control, the health authority has come up with more detailed prevention measures. Instead of imposing restrictions on the whole society, the special measures will target specific places that are particularly vulnerable to the virus. Stronger restrictions will be imposed on high-risk facilities. In the Seoul capital area and Busan, where the outbreak is serious, operations of entertainment establishments are banned. New regulations have been added. Everyone entering a building must fill out an entry log, and entertainment facilities must use QR log systems, not paper logs. Eating is prohibited at museums, sports stadiums, and theaters, and all facilities must appoint a quarantine supervisor.